Welcome to Spectator MD. I'm Marvin Base. Today we will explore autism, not just as a diagnosis, but as a lived experience through a professional and deeply personal lens. Today I have with me an autism specialist as well as a physician and parent of a child with autism, who hopefully will shed some light on some real world challenges, insights, and meaningful understanding about autism. And our discussion will go beyond theory and diagnosis. Thank you,
Thank you. Thank
doctors,
you for having us.
for being here today.
Appreciate it.
Dr. Lisa Liberatore, who I've known for quite a few years.
Yep.
I know they call you Dr. Lisa here.
Yeah.
And Dr. Kim,
Yeah.
nice meeting you again.
Here again.
Great.
Yes.
So before we begin, why don't we just give a little background information on what it is you do?
Sure. So I'm Dr. Kimberly Reyes Giordano. I am a board certified behavior analyst. I'm a licensed psychologist and a licensed behavior analyst. I've had the distinct pleasure of being in this field for the last 21 years in a myriad of different capacities. I served the role, as many of our staff here today, as a direct support professional with young kids with autism early on in my career. I had the privilege of being mentored by some incredible people. And I, advanced my career, worked myself up, working for myself, working closely with schools, insurance-based companies, probably at this point, well into the hundreds of families. I still do that. I have a deep, profound love for what I do. Making change is really always my goal, even if it's small. Currently, I'm working with Love Michael, with the residents here. I also work with some schools in Brooklyn and in New Jersey with not the same kind of population, but behaviorally challenged populations, wide variety of diagnoses that those with autism are comorbid for. So we've got, ADHD, learning disabilities, et cetera, using the same principles because they are not autism specific, despite what everyone says. And really, looking to affect and change the lives of, those who are very young, and now the fortune of those who are, beyond that cliff of 21. And Dr. Lisa knows this. I'm very grateful for this experience, as I had never worked with adults up until 2 years ago. I think with perhaps a little bit of trepidation that I have now come to realize was very silly. Because I thoroughly enjoy what I do here. It's immensely rewarding, and the population gives back as much as I give to them.
Wow, you've done quite a bit. Great.
Maybe.
Wow.
Not as much as others.
Yeah. And Lisa, I pretty much know a lot about you, and I don't have to tell you, I have immense respect and admiration for you.
Thank you.
Who you are and what you do. But
Thanks,
please,
Marvin.
go ahead.
So for those who don't know me, Dr. Lisa Liberatore, my husband and I, my husband's Dr. Dimitri Casares. We met in college, went through college and medical school together. I went into otolaryngology, ENT. Dimitri's a urologist, had 2 children, and 2 boys, and it's our younger son, Michael, who really inspired the work that we do now. Michael is on the autism spectrum. Now they classify it in terms of levels. So let's just say Michael's level 3, which means high support needs. Doesn't take away from all the beautiful things, and we'll talk about that later. So after having a private practice for 25 years, it became evident really during COVID that we had to make a decision as a family to step away from my practice so that we could focus full time on hopefully solving this problem with, who will be there beyond the lives of the parents. And I said that quickly, but it's really something that parents understand, that if you have a child with special needs, just like any parent, you worry, but you worry particularly about what's going to happen when you're no longer there. And so that really, we had already started the nonprofit Love Michael in 10 years ago, but 5 years ago we pivoted to really focusing on residential solutions for young men and women on the spectrum who wanted to live separate from their parents but need support. And so you'll hear about Love Michael and Love Michael Homes. So I'm the co-founder with Dimitri of Love Michael Homes, and mom of Michael, who's now 28 years old. And my medical part of my world really is directed towards helping healthcare disparities and how to help our guys get better healthcare, because that is definitely a huge problem. So.
Great. And, I forgot to mention that, I introduced you as a physician and a parent of a child with autism, but I really consider you a autism specialist in your own right as well. And I'm sure that most people who know you do as well. Mm-hmm. Am I correct, Dr.
Yes,
Kim?
I would say that's accurate.
Yeah. So why don't we just start, for those who have or have not met or know anyone with autism, as to the definition, and because
I think that's really a great place to start, because so many people think they know what autism is, even parents. And their famous saying is, if you know one person with autism, you know one person with autism. And that was true for me too. So you really, autism is so complex, and I'll let Dr. Kim, from a clinical standpoint, define it, and then we can go into more on that.
I was at a lunch very early on with Dr. Lisa, and we were with a group of people from the church, and she said, could you come up with a one-liner to describe autism as not even like a sales pitch, but this idea of can you understand it in a sentence? And yes, it's very difficult, but I think a lot about that particular request. And what's the best way, I think now is, these are individuals who are navigating challenges, right? They're not afflicted, meaning that it's something that they are, that has been thrust upon them and that can never get better. They're navigating challenges in social relationships, in their style of communication, as well as what we call, stereotypy or rigidity, right? So things that they can be less flexible about. But in a nutshell, that would be the one-liner to describe it. And across all the individuals with autism, there are multiple hundreds, thousands of manifestations of what that looks like. But if that was the one-liner, it would probably be that.
Mm-hmm.
So when you say you met one child with autism, and I would assume is because that every child is so unique in their characteristics that no one child is alike. So
yes, I mean, as more and more children are getting diagnosed, and we have more years of observation and understanding, there does seem to be some similarities and almost cluster into groups, into categories. So there's definitely common threads among certain. So when you say social difficulties, that can be somebody who is very verbal and wants to talk to you, and you think, wow, that person is socially engaging, but there's not reciprocating conversation. So it's a one-way conversation where, I'm going to talk about what I want to talk about the whole time, and you really struggle after a minute or two to say, okay, how do I change the subject? So it's like understanding social cues, and you can think about how many different ways that can present, but that's one category. And then another category is, so that's social. Communication is kind of tied to that a little bit. Mm-hmm. Communication can be somebody who is not able to speak at all and maybe doesn't understand as much. Somebody who cannot speak but understands everything, in sometimes even genius level, but just can't verbally express it. or somebody that's speaking a lot, but the content of what they're speaking is not really functional. If I can only say a script and over again, I'm speaking, but it's not really communicating what I want. So it's really like the more, and then the last part, that rigidity or that stereotypic behavior, I mean, there's so many manifestations of that. Somebody will be rocking back and forth. I mean, we all kind of have stereotypic, right? You're tapping your foot, playing with your hair, flapping your fingers across your face. Whatever that is, we've come to know that that is the person's way of reducing anxiety. It's the way that they've helped themselves cope with the overwhelming stress and anxiety they feel. And I would say, we know more and more. And again, because technology is getting better and better, and we have technology to monitor things, no matter who we're talking about on the autism spectrum, the level of anxiety is way high. Like, we know the sympathetic, parasympathetic nervous system is not under our control. Sympathetic is your flight or fight. Your parasympathetic is your digestion and your calmness. Their sympathetic is way out of proportion to their parasympathetic. So some modalities you'll see are designed, what can we do to bring that into balance? So there's everybody's unique, because everybody has so many different variations of these three things in so many different ways. But then you add on anxiety, then you add on what's going on in their family life. Is something, are they accepted, not accepted? So then you could have depression. You could have, you could have OCD, because the anxiety is so severe that then you go to doing ritualistic behaviors to calm that down. So you really need to have a vast experience seeing a lot of people to really be able to understand autism. You can't see one or two. You need to, and that's why Dr. Kim's expertise is so valuable, because she sees all the kids in school, and then she, the more you see, the more examples, and you say, okay, that young man is like that young man that I saw. And so what helped that young man maybe will help that young man. But if you try that on that other young lady, it's not going to work. There's just not even one strategy that fits everybody. But there's categories of strategies. Yep. So maybe you could talk about categories of strategies that we see.
So a huge component of what I do behaviorally is in regards to assessing function, right? So anybody who knows about my field generally knows there are 4 functions of behavior that we try to categorize things into. Not because it's so simplistic, but I think because it helps us organize our strategies around how to help someone. So we look to determine if someone is engaging in particular behaviors, good or bad, or, in quotes, good or bad, for attention, escape, sensory seeking, or access to things, right? And so when we have that foundational knowledge, we can then assess all of the other things that Dr. Lisa spoke about, like, their what we call setting events, right? What is their home life like? Do they have siblings? How does the sibling engage with that person? How do the dynamics of the home play into those functions? What makes things worse? What makes things better? So that we can come up with an individualized, tailored approach to each individual and the needs that they present with. Which again, talking about autism, each person presents very differently, just like people in general, right? Mm-hmm. It just so happens that this population shares a similar set of traits that are diagnostically qualifiable.
Right. And I guess you have to find out what's unique in each and every individual and what makes them tick, so to speak.
Correct.
So that you can tailor that program to them. And it's not a one size fits all. Mm-hmm. Right?
Correct.
Okay, let's just kind of put everyone in this group and this is what we're going to do.
Correct.
Everyone is unique.
Yeah. So oftentimes when I consult with, whether it's the guys here or in my private practice or in the schools, I'll often get off the phone and parents will go, what do you want me to do? What should I do? And I go, I can't say anything. And they go, why not? I go, I've never met your kid.
Right.
I can't give you a prepackaged plan. I mean, I could, and the likelihood of your success will probably be very low. And I will just be another notch on that wall of failed interventions. You really have to spend time talking to parents, observing the kids, and then tailoring approach, not only that's individualistic to that kid or adult or adolescent, but really to the parents, their philosophy, their lifestyle, their barriers. I'll tell parents, we're going to start with protocol A, and we'll probably end up at G. And they'll go, why? I could do it. I go, I need you to be honest. If you can't remember things, it's too hard to take data, you don't like timers, you don't like noise, you don't like this, whatever it is, you got to be honest, because we'll get to an intervention that at least 80% of the time you can do. That still fits the need of your particular son or daughter, but that you are also going to be compliant with, because otherwise it's, just another failed attempt. And I'm all about, impacting change, small or large.
So you really have to treat the parent as well.
Or the organization or the school. Yeah, whatever
Parents
it is.
Have to be treated.
Have to be.
As well as the autistic person.
Absolutely.
Right?
Absolutely.
And they have to be heard, right? Wouldn't you agree?
Yes. The parents, the siblings, the teachers, the support professionals, anybody who really works with your son and daughter, as much as you can, help educate anybody who's interacting with your son and daughter, help educate them about autism. This is not about intelligence. Our guys are intelligent. They may respond differently. They may not look you in the eye because they're thinking. They may pause before answering, but that doesn't mean you need to fill the space with more questions. I love what Dr. Kim does. So before somebody, to help, I'll just take an example. One of our residents in one of the homes is coming in, is going to be moving in. This is like a big deal. She's lived at home her whole life and an only child. So her parents are aging. And we really want to set her up for success. So what do? Dr. Kim interviews the family. We need to know all about your daughter, everything. Things that she likes, things that she doesn't like, triggers, things that are phrases, little things, funny things, just anything that could help us. We say not step in it, right? No,
That's
we
a big
don't.
one.
We want to show the young person as much dignity, and we want to be as successful as possible, help her have agency, but realize that a lot of our guys, do need help. And sometimes, they do need help with some basic, daily living skills, even proper toothbrushing. It could be, the whole gamut of help. And so what we do is we prepare a whole social story all about Annie. Say it's Annie. All about Annie. And that is what the staff then reads, and all the teachers read, everybody reads, so that we meet Annie where she is, and she can be as successful as possible because we got the chance. We spent the time to know her, and not just there's a phrase called ableism, where you as a person who's not on the spectrum think you know better. You don't know better, right? We want to treat the person again where they respect their personality, respect them.
Right. So I think we touched on this a bit, but people think about autistic people in certain ways, right? And it's kind of like the myths. So, the myths that, they can't love in a meaningful way. They don't have intimacy. They don't have certain emotions, or they can't communicate. I mean, can you elaborate on that?
Yeah, I'll start. I think a big myth is that they are not interested in social relationships. And it goes back to some of the challenges that they're navigating. Dr. Lisa was talking about some of the difficulties with the socialization. In many cases, initiation is incredibly difficult, as well as reciprocation, right? So for some, I think I can think of at least 3 people at our Love Michael homes who are amazing initiators. but unable to reciprocate conversation, not so much, right? And so that, presents a challenge socially, right? In making friends, right? Well, they're not interested in making friends. They're just interested in talking at me. No, they're interested in making friends. They just don't know the nuances of that back and forth, right? That doesn't exist, I like to say, in their repertoire, their Rolodex, in their brain. That's not accessed so quickly. The idea that, when they're alone and just kind of walking around or hanging out, they're happy, they're content. I might argue that they might be happy or content, and they also might not know how to indicate to someone that they're bored or unhappy or not content, right? I think the other myths are, and this is a big one for me, I think, is that, some of the maladaptive behaviors you may see someone present, that's who they are. It gets misplaced as a personality trait. Oh, they're resistant. Well, they're resistant for other reasons, potentially, right? They're resistant because the directions are too hard to follow. The resistant is because you just interrupted something they were doing, right? Oftentimes, I think it's really hard. People will say that autism also sort of presents like an invisibility disorder in the regard that upon first glance, you may not know that that person has autism, right? They don't have a physical change to their face or their body. They're not in a wheelchair. They don't have a hearing device, right? So it's sort of like, until you really take the opportunity to dive in, you don't even understand that that person has some challenges of their own. So I think those are two big things for me, is that they're not interested in socialization, that when they're socially isolating, that's preferred. It could be true, it could not be true. I like to tell people, be curious. It's good to be curious, right? And then the other is that when you see these maladaptive behaviors, question why they're happening versus associating them with a poor trait. They're disrespectful when they speak. That's just how they grew up. That it's totally tolerated. Very well might be true, but it also could be a problem with communication, right? Not understanding the social nuances of a please or a thank you, or waiting to, inject into a conversation.
Yeah. Something that bothers me is, back in 2000, the CDC stated that there's about 1 in 150 to 200 kids with autism. And then prior to the DSM change in 2013, in 2012, it's like maybe 1 in 70, about.
Yeah.
And then in around 2020, it's 1 in 36. I don't know what it is as of today, but it kind of, Zach, can you look up what it is as of today, the autism rate?
Percentage?
Yeah. But it begs the question, right? The incidence is so dramatically increasing that what is the cause? Now, you can probably elaborate. I mean, obviously the change in the DSM, where it used to be Asperger's, PDD, NOS, pervasive developmental disorder, not otherwise specified, and autism. I would assume that change kind of encompassed a bigger envelope, right?
Partially, yeah.
Partially.
Yeah.
Right. But it's really difficult to believe that, that in and of itself can cause that kind of a change.
Yeah.
So about 1 in 31 children
So
in
now,
America, and then boys are 3 to 4 times more likely diagnosed than girls. The rate has increased over time from 1 in 36 in 2020 to 1 in 31 now.
right, so now it's 1 in 31. So I'd love to hear what both of you have to say about that. As far as,
We look back to like 1980, I think it was 1 in 10,000.
right,
I mean, it's from 1980, 1 in 10,000. So, I just came back from a few, updated medical conferences, and these are the leading experts, and still we don't know. We don't know what is going on. We know that there's genetics involved, but there's hundreds of genes. It's not one gene. Less than 15% of individuals on the spectrum have like a really classic single gene issue, which is usually manifested in a syndrome and with other health issues. So
I'm sorry to interrupt. What is do you know the percentage of the heritability?
less than 15%.
How?
Less than 15 or 15%.
Okay. So we're thinking that most of this is
De novo, something
environmental,
genetic that's triggered.
an epigenetic, a change that becomes an epigenetic change.
Epigenetic
right?
change triggered by something environmental, and is affecting multiple genes. It's not a one gene. And I really think we're going to have tremendous answers over the next couple of years because of the ability to use machine learning and analyze large amount of data.
So what, I haven't been to the latest conference, but what are they thinking about? Again, there's no one cause and there's many causes, right? And I think it's constellation of things that,
Right.
Change genes and then again, different genes in each person.
Right.
Because it could be hundreds of genes, right?
It's,
It could
yeah.
be 1,000 genes.
Right.
And no one person has the same gene change.
Right. That's why if they could subclassify autism, in even the word autism is probably wrong. They really even need to come up with 4 different names because the presentation is different. And so that might help as well. Subcategorizing, brain imaging. Again, a lot of these things are still very is used in the lab, is not standard of care for a physician to order. There's not a standard blood panel. And there's a lot of controversy still around what is the appropriate workup. And that's something that we're studying. We're working with a molecular biologist in Utica, Dr. Maria Condoritas, and we apply for funding for this. We got a little bit of funding, but we're going to take our 9 residents and we're going to imagine a starter kit of checking blood, urine, stool, saliva, grow the stem cells, look at the brain organelles, and try to understand if there's, first of all, is there any dietary intervention based on more precision medicine, getting that information and seeing is a commitment to, for instance, ultra-processed, dairy, gluten-free diet, low sugar, et cetera. Can there be an improvement? That's what Dr. Kim is helpful because we want to show that impact. Is there a reduction in self-injurious behaviors? Is there improvement in focus and sleep? Quality of life? Are the guys happier? Do they feel more? Is there improvement in their HRV, their heart rate variability, to see if that stress response is down? This is really, my interest. I'm tired of trial and error and trying to figure things out. And if I was going to leave your listeners with any point of this conversation is if there's a behavior that's somebody's hitting themselves or doing something to either hurt themselves or hurt somebody else, you have to look and think medical before proven otherwise. What changed? Is there something medical going on in that person's body that's causing them to feel that there's no other choice but to hurt themselves or to push away? And I can tell you that we've figured that out many times, that there's something medical, something dental on that was not realized.
You mean physical?
Yeah, medical, physical.
Medical, physical, not psychological
Not
or
psychological.
emotional. Right.
Yes.
Right. Okay.
Physical.
Right.
Migraines, dental, something with their feet, some skin lesion. Our guys, I'm saying guys, but I mean girls and guys, they don't report things to their caregivers, to their parents, or to the people taking care of them, or to the doctor. If they go to the doctor, if the doctor says, "How are you doing today, Marvin?" We'll hear, "Good." "Nothing bothering you?" "No." "Okay. Do you mind if I do a physical exam?" If you're with the person and they're in the doctor's office, insist that they have a proper medical exam. Change into a gown. Do a physical exam from head to toe, whether the person has complained or not. I guarantee you will find something small, but you're going to find it at that small stage, which would probably save that person, something that was needed to be treated at a much more advanced stage. And we have so many examples of that.
Yeah. And I mean, I know as far as diagnosing early in life, right? So when is the age where you would diagnose a child with autism? In other words, when would it be
most appropriate, like in terms of accuracy?
And obviously most apparent to say, hey,
right,
this child has autism, and it's not one thing or another.
Right. I think one of the things is, going back to that question you also asked about, like, why is the prevalence rate so much higher now, is I think that our understanding of what autism looks like and our ability to get that information out to the masses, right, for diagnosability has rapidly changed, right? What was in the 60s, refrigerator moms was what they were called, and that was the cause of autism at that point. And it was much more of a, let's say, a hush-hush, right? You put those kids in a different classroom, and now we're in an inclusive environment where we want to identify quickly so we can support, because that's what the data shows us, right? Early intervention, early detection, right? So going to that question, really, I think the data shows that 2 or 3 years old, right, is when a diagnosis is around that time is probably more valid than at 18 months. 18 months is possible. I would say that the hallmarks between 18 months and that age of 3 is pretty categorically similar. The big red flags: lack of response to name, right? You've had, going to Dr. Lisa's point, medical's been assessed, kids had a hearing test, hearing has checked out. There is no physical reason or structural reason for that issue to be occurring, right? So response to name is a big one. Next is a lack of eye contact, right? Again, withstanding that there's no visual impairment, right? Using items in a repetitive, stereotyped manner. Very classic examples, again, because autism afflicts boys more often than girls, is boys playing with the wheels on a truck over and over and over again, and having less functional play thereafter. No vroom vroom, no following mom down the train track, etc. Those are some really big hallmarks. Then, in some cases, parents will note a regression, that the child once, at one point, did have words, and now they don't, or their language has become inarticulate, or they're using a lot of pointing and gesturing where they once said baba, mama. Lack of, a neurotypical inventory of communicative language, right, is also another hallmark. You only have 5 words in your 3, right? I think one of the things is, for the sake of early intervention, in order usually to qualify for services, in the communication domain, you have to be typically 6 months or more behind, right? And so I think, the best thing that parents can do is, everybody has that sort of sensor, right? Keep an eye, be vigilant, keep a diary, right? If you have a sinking feeling, keep information, because it does really, that's a large part of how that diagnosis comes into play, right? Is its clinical impressions, history by a parent. You underreport, that can be problematic for your kid not, getting services fast enough. So, the key element is stay vigilant, know what the marks are, the categorical markers. Obviously, there are plenty more, again, as it is such a spectral disorder, but those are the ones that parents will go, yep, that was an issue. That was an issue. And then usually you get some morphing later on.
And I would assume that obviously we're leading to therapy, right?
Mm-hmm.
So different interventions, the earlier you catch it, the earlier you can start, quote, treating.
Helping.
You're helping,
Helping.
right? I've read about ABA and PRT. Do you want to just care to discuss a little bit about it? And
Yeah.
are they meaningful? Do they help? Does one therapy do a lot more than the other, et cetera?
I think it's a highly contentious topic at
Yeah,
times.
I would think so.
And I can't, pretend that I'm not of one particular camp, so to speak. I'm a behaviorist, right? That's my niche. That certainly doesn't mean that I'm not open to others. I think that with applied behavior analysis, I think one of the things is that we have probably the most research, right? I could be wrong, but I doubt it, that we have the most research, related to services on autism, right? And especially we're very data-driven, right? We're very interested in outcomes, right? So I think when you compare it to other types of methodologies, that's sort of the disconnect, right? So ABA is still considered the gold standard, especially when kids are younger, in terms of intervention, right? Because it's not a unified approach, right? It's incredibly unique again. It's just a set of strategies that, again, looks at function, looks at the individual, looks at the barriers, and says, this is the best way this kid can learn to say words. This is the best way this kid can learn to be potty trained, right? As opposed to, again, slapping on, trial and error kind of things. Again, we're looking at investigating what the difficulties are for that particular person and then tailoring our approaches that way. So obviously I'm a big proponent of ABA, but I work in schools where PT and OT and speech are critical elements. Counseling is a critical element. I don't deny all the parents that I've worked with that have tried other therapies that have, indicated that those were helpful, right? So I think that there are, in good ways, we have a plethora of options, right? I'm a person of science, so I say follow the science and then add on, right? So I would always probably recommend to parents, especially early on, seek out ABA services. Again, we're now in a day and age where at least our insurance is covering it for kids on the spectrum, which wasn't necessarily the case when I first started out 21 years ago. Everybody paid private, made it really, really unlikely for people who were economically disadvantaged to access the same type of services.
Correct. Yeah.
So lead with the science and add on. That's what I would say.
Yeah.
I mean, and somebody said something to me many years ago, that there's nothing worse than bad ABA. So just like doctors, there's good doctors, there's not good doctors. There's great ABA therapists, and there's nightmare stories as well. Dr. Kim is a phenomenal ABA therapist because she's, there's humor, it doesn't have to be, I don't know, you hear myths about that too. We're not locking somebody in a room and sitting there for hours and drilling. It's
I've actually
you want to
heard,
learn something?
Yeah.
Okay, so example, Anthony wants to learn how to swim. Swim instructor comes, who's a great swim instructor, fabulous, but never worked with our guys. So we bring Dr. Kim and say, okay, what do we want Anthony to learn how to do? Well, we would love to get him just getting his face in the water, right? Because he's so afraid he doesn't want to put his face in the water. So we give the swimming coach some tools, some strategies, which are ABA principles. We're going to write, what are the steps? Well, first we just got to put our toe in the water. And then so everything is slow. Everything is patient. Everything is followed with a lot of positive praise. Everything is followed with, what are we doing afterwards? That's something to celebrate after. It's a kind of mindset that anything that's worth learning, it just takes time to learn. And if we go about it the right way, we're going to be successful. But if we rush the process, if we don't respect the fact that new things are stressful, that communication is difficult, then and the anxiety over what's going to happen, and am I going to be forced? Am I going to be all those things? If you take the time, you write it down, because our guys do really well with visual. Even if you could speak, even if you know the steps, the visual just helps reduce the anxiety. Anything we can do to reduce anxiety is going to help our guys. And so applied behavior analysis is really understanding human behavior and what makes us want to do something more and what makes us not want to do it. Throwing Anthony into the pool is not the way to do it.
He wanted to do.
You know, he's never going to go into a pool again. So, but of course, we've heard, you know, really bad stories about applied behavior analysts, and that's not what we condone, of course. And nobody I know would want to use punishment, for instance, as we don't use negative reinforcer to get some.
Only a positive reinforcer.
Only positive.
And if you don't do it, it's
and you
nothing.
know you have to be realistic. You can't rush a lesson. You can't rush something. If you want to teach something, you know, don't try to squeeze it into a rushed window. And you want to teach John how to shave. Well, we're gonna need a good hour, because we're gonna set up everything. We're gonna, you know, show this stuff first. We're gonna maybe start with a warm towel. How does that feel? You get where I'm going. Everything is slow,
right?
piecemeal,
slowly. Yeah.
End on a positive note. Maybe we can only do 3 steps. Then we're gonna come back to it. You know, it is taken, in my experience with Mike, for instance, many times, 3 times to get to where he'll be accepting of it. But if he really wants to do it, he's going to do it. He's got to overcome sometimes the sensory barriers, like skiing. He's a black diamond skier. He didn't start as a black diamond skier. He didn't even want to put the gloves and the hat on, the helmet on. So we stand outside the door, go, you want to come out? It's freezing out here. You cannot come out unless you put the gloves on. Finally puts the gloves on. You got to put the helmet on. It's so sensory annoying to him, right? But he saw the skiing and he really wanted to try the skiing. So it took like 2 or 3 times to kind of overcome those real significant sensory, it feels horrible, like out of his skin, to get to the point that, oh, wow, this is so worth it. And suddenly those discomforts kind of went away, didn't bother him anymore. So you have to be patient. And, you know, after doing this 28 years, that's my lesson.
Yeah.
That's my parent tip.
Yeah, because I guess there's hypersensitive and then there could be hyposensitive.
For sure.
Right?
Yeah.
And so there's, and which leads me, obviously we have now level 1, level 2, and level 3. Do certain children, kids, adults in the various levels progress with certain steps differently? Well, I shouldn't. In level 1, the cognitive and language skills are pretty much there, right? Mostly. Am I right? Or
say that again. Sorry.
The cognitive and language skills and speech is pretty much there, if not even above
perhaps
expectations. And it's more the social interaction and maybe the awkwardness of
or maybe some daily living, executive functioning stuff.
The gestures and things like that. So they need a low level of support.
Not really.
No?
And
So that's a myth.
That's a myth.
You know, that's a
myth.
myth.
In our society, with jobs being so competitive and the fast pace of everything, people have no patience. I actually feel sometimes worse for the level 1 autistic because they're so misunderstood, because they could be so academically successful and therefore people don't have the same patience. I mean, I've seen that, I've witnessed that so much. And so there's loneliness and depression, and there's unemployment, not even unemployment, underemployment. I mean, these are highly educated sometimes, you know, have master's degrees, and they're doing jobs that are so not in the field that they wanted to, because they couldn't compete with the soft skills. So the loneliness and the isolation is there. you know.
So you find them they examine themselves more critically, or just as much as
Oh yeah,
we do?
They feel terrible.
I mean,
They feel terrible. So a lot of times, especially somebody who has not yet been diagnosed. I think I've spoken to quite a few people who, when they do get the diagnosis of autism, and this happens a lot in the young ladies now, especially over 30, sometimes their children are getting diagnosed and like, hey, that kind of sounds like me, and that kind of sounds like me. And then they realize they get their diagnosis, and it's sort of like, oh, so there wasn't something like wrong with me. It was just a different, I had a different challenge, and it sometimes is sort of it's really helpful. It's really helpful to have, and it's helpful to explain to maybe others who maybe were not as kind or so. I think that the category of level 1, level 2, level 3, there's definitely different support that you need. And certainly level 3 is the highest level. And I say caregiver challenges are more in that category. But there's challenges in all levels because of society, unfortunately, unless you find like the ideal situation. And, Temple Grandin is a leading ambassador for individuals on the spectrum. And she says, Silicon Valley is all autism, right? I mean, if you can channel that intense focus and hyper interest,
change the world.
I mean, that's who you want working on the most complicated things. But don't expect that person to also, maybe be comfortable in a crowded, Friday night bar, with everybody. It's more one-on-one, quieter.
What are the services? So then, what are the gaps that you feel are needed in employment services, adult support services? I mean, you pick. I mean, you probably.
I think what Dr. Lisa said also about like level 1 is that, I think people look at that level and they go, you don't need intensive support, but that doesn't mean you don't need any support, right? And again, it goes back to that invisible disability kind of thing where it's like, where do you need support? And you need support in whether it's a job interview, keeping a good schedule, organizing your home, getting into good shower routines, cleaning routines, etc. Ever since I started working here, the cliff to me that they call after 21, when all of the sort of government-funded services begin to deteriorate rapidly, that is certainly where the gap is, right? How do we go from people before 21, who had to be registered behavior technicians to work with an individual with autism, or had to have particular trainings. And then after 21, just about anybody can work with very little or no training whatsoever, right? No understanding of autism. For me, that's a big sort of area where it just doesn't seem logical, right? This person at 20 years old and 364 days is exactly the same person at 21 years old, right? So why is the type of person who can work with them now suddenly different? Why are we not investing in these people who are caretakers, even for our level 1 guys who understand the nuances that are very, very different for a level 1 person? They don't need you to help them with showering, but they do need you to help them understand how to run a household. They do need you to understand the idea of time management, executive functioning kind of stuff. So that, I would say, is where the biggest gap is. And that encompasses whether it's employment, advocacy, higher education, et cetera. I mean, only now are we starting to get some of these programs that are a little bit more autism friendly in, I know BMCC has one that has like a bigger, network and so forth, but these are still relatively new. So that's where I would say that some of our efforts need to go to.
And with some support, individuals, can be it can be very, very effective. And we see that every day. We have a young man that works with us, and he recently was able to get some social services and get a job coach. And although he works here and was doing very well we knew that he has much more potential, but he needed additional coaching. And it's been, I mean, she's been super successful at helping, and he has so much more confidence. You know, everybody wants to really feel that sense of purpose and to be successful. And we see that. But what Dr. Kim was saying is a direct support professional who might work with somebody with higher support needs. Usually when they're hired, you pretty much need a high school degree, a background check, and fingerprinting. You take a couple of online courses to be cleared to work with the individual, and that is it. Then supposedly it's up to the parent to train the individual to work with their son or daughter. And then that person becomes a lifeline if they're good. And sometimes, you know, there's really angels that go into this field, some not, but some are. But life happens, and then that person maybe has to leave, and then it's a total crisis. So, I mean, what we're doing with Love Michael Homes, why this is so unique, is that we've actually brought together, so we have 3 homes, and we have 9 residents. So if you think about it, each of those residents now can hire a support professional. And so we are able to offer 15 individuals full-time work because they work with the whole group. And so if one person has to leave, everything doesn't fall apart, which is typically what happens. And we brought on Dr. Kim, who is not a service that's covered by the government, even though it's so critically necessary. And autism is the largest growing disability, categorized as disability. So really we should be training our direct support professionals on autism because it's so prevalent, and the strategies that the support professionals need is not something nice to have. It's something critical. And without that expertise, without that training, we'll see an increase in self-injurious behaviors, maladaptive behaviors, sleeping issues, medical health, you know, we said dental hygiene, everything about that person's quality of life and health goes down. So we're going to be going to Albany. We're going to be going to Washington. Our part of our job now, doing this now for 6 years, is really educating our government and anybody who will listen that we need to do better. We can't just expect aging parents to, you know, pretend like they're going to be there forever, and then it really is a crisis. It's not fair for the young person. It's not fair for the parents. Not fair for society, because society is not prepared. They end up, I've gotten several phone calls from individuals, physicians in emergency rooms, who literally the adult was abandoned in the hospital. Parents left because they just did not know what to do, and they could not care for their adult child. So that's not what we see. We see that our guys are doing great. I mean, they are, to get back to about, do they want friends? They want friends. They do vision boards. Their vision boards show couples, dogs, homes. One of the young men sends me Zillow articles about Love Michael's married home, because, you know, we got to think about that. Dr. Lisa, I want to get married. Are you going to do a Love Michael married home? Why not?
Autistic people want to get married.
You saw Love is on the Spectrum. One of the great things about
sure.
TV is they bring awareness to issues, and Love on the Spectrum is just a great one. I mean,
multiple countries now at this point, right?
They want love. They want everything everyone else wants.
It's quality of life.
A sense of belonging.
Self-esteem. And
of belonging, a sense of purpose.
Yeah.
It's what everybody wants. That's what they want.
So in New York, is New York different from other states as far as services or as far in all categories?
Very different.
New York, New Jersey are just
better or
alone.
worse?
I can't qualify that. I would say that it's very different. I just actually learned the other day that in Colorado, if your child is diagnosed with autism, it's like supersedes the need for an IEP when they're in school, because the medical diagnosis is like sufficient, whereas like in New York State, you would still need an IEP, whether or not they go to like a private school or a public school. So I think it just
Excuse
really,
me, so
Yeah.
IEP is,
an individualized education plan.
okay,
Yep.
great.
So every state varies differently. I've had clients who have moved from other states.
Absolutely.
Yeah, because they can't find a sufficient placement for their child. Specifically, they've moved from Jersey. Most of my clients, especially when I work in private schools, they have to file for, I believe the word is pendency.
Mhm.
They have to advocate that the accommodations that New York City is willing to give, right, are not sufficient to support their child, right? And in some other states, I don't even know if that's an option. So I think it varies very widely. And so I think most times when you read, when you listen to a podcast or you read some of these, like, your kid has autism, what are you doing next? It'll say, check your state regulations or like your state programs, because it's not a one size fits all at all.
So it's basically, here's a list of recommendations.
Yeah, absolutely.
Take it easy, right?
So
Yeah.
when you become an adult, when you age out of school and you're an adult, you can apply for something. Well, you can do it beforehand, but it's called a self-directed budget. And so in the past, if you had a disability and you didn't live with your parents, you were in an institution. So they got rid of the institutions in the 70s, but there was really no game plan for what we were going to do for these thousands of individuals who still needed help. So this concept of self-direction came about, and it's a budget from the state that varies according to the level of disability. So you go through an extensive questionnaire with a team. It's complicated to go into, but you have this extensive questionnaire that you have to answer, and it basically can gauge your level of support that you need. And New York is actually pretty generous versus other states. For instance, for the level of disability that Michael has, if compared to Florida, it's about 3 times more here that he will get in his budget versus Florida. So, there are things about other states that are better. Like, it depends on your perspective, but in a lot of other states like Florida and Arizona and Texas, because we hear a lot of families moving there, they will allow sort of intentional communities that are built to help individuals neurodiverse or autism. So we're not allowed in New York to do that. They want true, what they say, community integration. However, so like you're not going to go into one neighborhood and it's like, this is for autism. And so I'm hearing a lot of communities developing in Florida, like a lot around autism. In New York, and what we're doing here is we kind of done the next best thing, which is the homes are not far from each other. So it makes it cost efficient for professionals to come and help in the homes. They don't have to travel. They're not traveling far for each place. We can keep an eye on people. If we have a staff call out, we usually can have somebody from another house go over. There's economy of scale by being in the close vicinity to each other, but they're not all clustered in a sort of gated community.
Yeah. I saw what you did, and I think it's terrific. Yeah. I only wish that, there was more of that around.
That's our goal.
Yeah. Yeah. So what would you want, a pediatrician or a teacher or a general practitioner, what do you wish they understood more about autism? Someone like me, or that, until recently, really, it was kind of, it's a diagnosis, but it was not a so what, but just here's a referral.
Mm-hmm.
Would you want, I mean, what do you think? Is there a gap between the teacher and the medical provider?
I think what I'd want both of them to understand is that time is precious, right? I mean, don't get me wrong, you should obviously, consider, waiting, watching, and seeing, because, some of these things developmentally will sort of hash themselves out. But I think kind of going back to what we were talking about before about being vigilant, understanding what you should be looking for, right? And not, again, discounting those things as personality traits, malicious behavior, idiosyncrasies, quirks, right? And go, that might be a sign of something else. We'll both
Right.
keep an eye on this, right? Let's stay in close communication, right? I think, again, from a psychological perspective, and even when I work with psychiatrists, a large bulk of what actually winds up going to treatment is self-disclosed. Right? If a patient, a client doesn't tell me something and I'm not asking the right questions, I won't know, right? So I think as a physician is, those probing questions that will enlighten you as to whether or not there's like a significant issue here or not. As uncomfortable as they might be, you should ask those things, right? Yes, it gets people alert and, sort of vigilant about, should I be nervous? But at the same time, again, time is not always on our side. And, waiting till a kid is, 4, 5, 6, you've just lost a lot of time. You haven't lost everything. And I think that's one of the things I also want to be very clear about. One of the things I think I try to impart on the staff all the time is these are adults. That doesn't mean they're not equipped for change. Everyone changes over their lifespan. Everybody's capable of change. Their change might be a lot slower in some cases and faster in others, but it's possible. And so we should always strive for it. So again, no matter how far along in the diagnosis you are, right, strive for change. Move that needle just a hair to the right.
Because I would think, so, I would think so there's misdiagnosis, especially at the younger age. Someone may be labeled as ADHD or anxiety or autism, and it's vice versa, right?
As they are very comorbid with each
right?
other. So yeah.
So what is the overlay of, let's say, do we know of ADHD and autism and anxiety and autism or both with, I would think that there's ADHD and anxiety in autism. I just don't know.
There is. I don't know the percentage,
percentage.
but
Yeah.
it's high.
Significant.
It's
Yeah.
significant, and OCD and sensory
Right.
sensory sensitivities. I think for physicians and for teachers, I think that everybody has to put their ego in check, and just because you've been doing something for a long time doesn't mean you know everything. I try to impart this, to the staff too. I'm always learning. You're always learning. You can always learn. And with autism, we don't have all the answers. So you have to keep an open mind. New information is coming out. And Dr. Kim has taught me so many things. And sometimes there are little things that are like huge impact. But if I was like, oh, I knew this, I'm a doctor. It's my child. No, you ask for help. You put your ego in check and you say, I really want my time with Michael to be more, more fruitful, more nice, more calm.
Yeah.
What do you think? And then we had a discussion, and she's like, I'll give you a little personal example. He loved to come to my house for some reason and right away run to the basement and go in the shower. Take everything off, throw all the clothes in the shower, go in the shower. And I'm running after him, like, what do you, what's this about? And then like a chicken, right, running after him. So she's like, do you have a problem with him taking a shower? I'm like, no, not really. Okay. So you gotta, control a little bit. So you're gonna say, hey, Mike, you're coming over. What do you want to do? We're gonna do yoga and go for a walk, and then you're gonna take a shower. And you just put it right out there. I'm gonna take a shower. He looked at me like I was like 10 heads. And he all right, took a shower that one time. Then he never took a shower again. Because there was some kind of it was fun. It was like he got some kind of, excitement over it. Even if I, try to be cool, calm, I'm not, right? You're just not. They sense it. So sometimes it's like a knowing eye, somebody who's done a lot can always give you some feedback. And you see sometimes people who are not willing to kind of think that they can learn something or do something differently. That upsets me, because I think you can always learn. We always know better. We didn't do everything right as parents. We didn't do everything right as teachers. We're always learning. Just kind of keep your ego in check. And I think it's going to help these guys, do better. The more we can empathize with what's happening.
Yeah. When, Lisa, when did you first suspect that Michael may have autism? Alexander's 13 months older than Mike, and Alexander did not speak until he was 2 years old. And then after 2 years, so he turned 2 in October, and then I was concerned, of course, and then January, everything just came out like full sentence, blah, 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 blah. I'm like, okay, boys talk later, blah, blah, blah. So when Michael didn't start speaking, and his birthday was November, so like a month later, I really didn't worry so much. And the doctor said, if he doesn't speak, by January, I want you to have him evaluated from early intervention. So we went for early intervention February. So it was 2 years and a few months. You basically meet all kinds of allied professionals who, I never even knew what they did. PT, OT, all these different professionals. And after spending a day getting an evaluation, no blood work, no imaging, the psychologist, who was the last person to see while he was playing on the floor, sort of, said, I know what he's got. I said, what does he have? He said, PDD. I'm like, what is that? Now, remember, I'm a doctor, already an ear, nose, and throat doctor, medical school, never had a course on autism, never saw a patient in residency, never saw a patient. So he said, PDD. I didn't know what that was. Pervasive developmental disorder. I'm like, what is that? Well, there's a spectrum of autism, and that's when you just kind of go blah, blah, blah. You don't hear anything. Didn't even go with anybody, because I really thought they were just going to give me some speech, therapy. So that was the great bedside manner that you get the diagnosis, and then you just pick up your child and you walk outside and you don't know what you're going to do. And then they give you a list of people that you should go try to see who can't have any availability for 6 months to a year. And at that time, they didn't take any insurance. So, the whole thing was just a horrible, you're used to getting a diagnosis and then, okay, what do I need to do? And then once you realize that it's not going to work like that, this is going to be a long process. It's going to take a lot. It's going to take the whole family. And, that was my experience. And I actually don't think it's very different now. I think it's pretty much the same. I was just reading the average age of diagnosis is still 4 years old. Yeah. So it's not, early intervention, the earlier the better, but still, 4 years old, and 7 in communities where there's less access. Right. So we have to do better. And you're a physician.
I'm a physician,
at the time, right?
Yeah.
And Dimitri, your husband, is a physician.
Oh, yeah.
And
he didn't believe it.
It didn't make one bit of difference.
No, he was like, what?
Right?
That's not, let's get a second opinion.
Right.
So you get a second opinion.
I would have done the same thing, yeah,
Get a second opinion.
Yeah.
They videotaped him for 3 days or 2 days. And at that time, $1,500 was a lot of money. And then you sit down with the specialist and she said, so here it is, he's autistic. And then, okay. So, I think that there's hope right now. I think things are definitely better. There's no question they're better for parents now in terms of understanding and more awareness. We've moved away from awareness in our world to, I don't even want to say acceptance, because nobody needs to be accepted. Mm-hmm. Understood.
Right.
Understood.
Right.
Understood how to help.
Right.
And we're all not perfect. All of us don't check the box.
Yeah, right.
None of us check the box.
Right.
All the boxes,
Definitely not me.
Yes.
I don't check any of them. Maybe half.
Yeah.
No. I agree because, each one of us have certain quirks and behaviors that are not neurotypical.
Yeah.
If we use neurotypical
Well,
as a word to mean, I don't want to say normal, standard.
they
maybe.
say in the language, what the words we use matter. So we hopefully didn't offend anybody because there's person first language sometimes, a person who has autism or autistic person,
right?
Neurodiverse. There's the language we use is super important, and I think just even being sensitive to that is important. But the Autism Society is the adults who have a voice will say nothing about us without us. So don't make policies and decisions without having us in the room. And next time we speak, maybe we'll invite some of our participants who do say, "I'm here to speak on behalf of Michael and et cetera, who cannot speak." That we are just part of the human continuum. There is it's not a disability. We're not a victim. This is just a different way of thinking, different way of communicating. Some would say better, more intuitive. And so, let's see what the next 10 years looks like. But I think the next 10 years are going to be very different for the story of autism.
So, how so?
I think because of brain-computer interface and really understanding what's going on beyond just the surface is really exciting. I think understanding more about the body on a cellular level to really understand what's going on with the mitochondria, what's going on with the gut microbiome. We're only scratching the surface. We know that there's a dysbiosis or a lack of diversity in the gut flora of individuals on the spectrum. Why is that happening? What are those gut organisms doing? We know that's the second brain. There's just so much we don't know. We hardly know anything about the brain. What better imaging we have than trying to go through an MRI machine, less obstacles to really understanding the body. And I think we're going to know a lot more about what's really going on that's causing the difficulty with communication and the social anxiety and the need for this rigidity to kind of cope with what's going on in the world, what's going on in their world, in the environment.
I wanted to ask you, what do you think is the hardest thing about raising an autistic adult right now? And also, what has surprised you the most as far as Michael?
Well, I think the hardest part is really creating an empathetic world, because you still walk on eggshells, in certain environments like, restaurants, movie theaters, because you don't know how the sensory
Judgmentalized, right?
being judged. Yeah. We live a little bit in this beautiful bubble here with being, we're sitting right now in the Dormition of the Virgin Mary Cathedral. It's a church in Southampton that we've had a 28-year relationship with. They actually baptized Michael here. It's an amazing leadership who has walked alongside us through the whole journey, including when Michael had to go into a crisis home for almost 2 years. They visited him. They told him, "We love you, Mike. You're going to get, this is going to be a transition period." So they are our model hinges on having a faith-based supportive partner, not pushing any religious agenda, because that's a very individual, but it's filled with loving people who have a philanthropic mandate and are mission-driven. And they've really embraced our guys in a way that they have like all these new aunts and uncles and family who are looking out for them. And so the hardest part of raising an autistic adult is you can't do it alone. You really can't do it alone. And when you look around, a lot of times your family is not there. They don't understand. They haven't really spent the time to get to have a relationship. So those family events are really the hardest time for our guys. Holidays are the hardest time. Everybody's getting together. It's loud. It's noisy. There's a lot of food. It's different. We're going to someone's house. So that's when our guys are supposed to kind of almost feel like they're under a microscope to perform a certain way or be a certain way. So you tend to not want to do those things, right? In what we're doing here, every Sunday is family night. We have family dinner. Everybody comes over. Somebody wants to pace. Somebody wants to jump on the mini tramp. Like, who cares? Be yourself. And the parents who are part of this group now, and we call them family. I didn't came up with that name. That's from Harry Psaros. He wrote a wonderful, beautiful book about a father raising his son. They are people that are going to be here for Michael for his lifetime. And one of us is going to be the last one living, right? So we know, but right now we have 19 parents who every Tuesday night we join a Zoom call. They don't live here. They don't live in Southampton. They've chosen, they and their child, and they have chosen this to be the life that they want, with friends, living in a home, connected to this church, coming here for all kinds of amazing classes, and to be part of a community that loves and accepts them. So parents are reaching out now because, they are feeling lonely. They are feeling like, where's all the kids? And, when you're in school, you have there's so much around. Now you don't, right? You age out of school, who's around? And you turn to the people, your family, they're doing their thing. Sibs they want their life. So, nobody wants to be alone. Nobody wants to be forgotten. So that's what this whole thing is about. And hopefully we can inspire other communities to replicate this. That's why we do a conference. I felt really compelled to doing a conference starting 3 years ago, just to share what we've done, just to get people started. And now this will be our third year. And we expect over 100 people to come. Dr. Kondaridis will come and share her research on what she's doing. We have Dr. Satish coming. He's our psychiatrist, and he treats pretty much all of our guys here, and very, very thoughtful, the minimal pharmacological intervention necessary. Not everybody has that philosophy, right? And then we have a wonderful dentist, Dr. Furlano, and his group, because dental care is such a difficult thing. One of our young men needed to be sedated anytime he got his teeth cleaned. So that, in a dentist's office. So, of course, he didn't go very often. And through Furlano's office, they were able to take the time, like I said, that very gentle approach, desensitizing. Jackie would just go just to visit, then leave, touch the equipment, listen to the sound of the machine. And now Jack made this really cool t-shirt. All the staff wear the t-shirt when he comes in. I mean, there are amazing people out there that are drawn to what we do. And those are the kind of people that, I actually love being around. I met some of the nicest people. These parents are like amazing people. So Michael actually has been the catalyst for really making a beautiful life for us. And all we need to do is try to understand that he's going to have good days and bad days. And like all of us.
Yeah. And what surprised you the most about Mike?
What surprised me the most is Michael's, how much he really loves his friends. Like he didn't, he'd go to school, it was a small class. He might say something about one or two friends in school very, but I didn't really see him in class. I didn't really see that reaction. Now, I mean, the love, the you could see it in his eyes when Christian sings, when Anthony sings, when Jenna talks about Love Michael. He's so proud of his friends. It's like beautiful. And I'm very surprised. I mean, I'm just surprised of how this beautiful friendship circle has developed, and how he's very much a part of it, and how those who maybe have less support needs see him as a friend. They don't see him for his challenges. They don't see that Michael doesn't talk a lot, but he understands everything. And the parents may say, oh, I'll hear this sometimes, my child is high functioning, they don't need that. And I say, well, we don't use those words. We don't say high functioning, low functioning. Do you want to be called a low functioning adult? Meanwhile, you can do this and this and this and this because there's one thing that you struggle with, which is verbally communicating. So we say, what's a support need? But to see this group who would never be in a class together, in a typical school class, they would not be brought together. They are. They see each other as equals. They see each other as just so important. And that's what I'm most surprised. I'm not surprised, but I'm just pleasantly surprised, I would say, to see this happen.
Right. So which support services would you say were useful or meaningful, and which were like, oh, that were a waste of time?
ABA was definitely the most number one.
Right.
And actually one of the teachers, Dr. Kim, is the cousin of an amazing behavioralist, Sarah Cull, who knows Michael since he's 4 years old. And Sarah is one of the most amazing teachers and behavioralists. And when we had this program, she was on the board for a little bit. And I said, we want to do some real research. We want to really measure the impact of what we're doing. And she said, I really want you to reach out to my cousin, because she's really more process-driven, more research-driven. So Sarah is, that's the legacy. That's why I was very comfortable. And then I would say the other people who are really helpful are people who are really passionate about what they do and are patient at teaching it. So you don't necessarily have to be autism trained. You just have to be willing to learn and to listen and to adapt. So Michael's a competitive rower. His rowing coach was not an ABA therapist or an autism specialist. He was just humble enough to go and research and understand and talk and listen to Sarah and others. And Michael was able to compete, and you wouldn't even know he had a disability when you saw him. He actually brought the first cup for port rowing back to that team, he and Molly. So, and then I think nutrition is super important. I think our guys have a tremendous amount of sensitivity, oral sensitivity, and textural sensitivity. So their food preference can be very, very restricted if you don't understand that. So for instance, one young man only ate chicken fingers and mozzarella sticks, and he's 20 years old. And Ensure, that was it. And I said, there's no way we're going to keep this kid healthy. How are we going to keep him healthy if that's his diet? So we brought in a specialist for that. I'll give a shout out, Chef Stephanie Sachs. And she took the time to sit with him and go through all the different foods, piece by piece, tiny piece by tiny piece, asking him, would you taste this? And then have a little piece of chicken cutlet, have a little piece of this. And she figured out that really it's all about texture, crunchy. Jack wants crunchy. Get an air fryer, put the broccoli and the cauliflower. Jack's eating cauliflower and broccoli first time in 21 years because somebody took the time. And again, those principles, so hopefully that helps, those little.
So, it sounds like you've, done a great job, but through childhood all the way up to adulthood. Is there anything that you know now that you wish you knew when he was 3 or 13 or 23? Is there any changes that you would make, or you would advise someone that, you
I mean,
to do?
I think I was mentioning to you before that I thought I should write a book about the money wasted on things that were kind of promised to be, beneficial. But Michael still has quite a few challenges that I think mostly arise from lack of being able to communicate verbally, and we're working on that. We're constantly working on that. But the younger kids now have the tools that were not available.
Mhm.
So if you see younger kids now, they may have their iPhone, and if they're not minimally speaking, they're using their finger. They're not even looking at it because they have such muscle memory, and they're communicating.
Right.
And so I think just more advancements, better technology. I do believe that diet makes a difference. If I had to look at all the interventions, exercise, but we stumbled on those things kind of serendipitously, and those tend to be like the really important things. So I wouldn't have done anything different. But I am looking now with a new lens on Michael's health, and looking with newer tools to look at inflammatory markers, cytokine markers, things that are still very much not standard of care, to see if we can understand, like I said, the microbiome. So this is sort of like our guy's second chance at seeing if we can get them just feeling healthier, and hopefully by feeling healthier, feeling more comfortable in their bodies, maybe they might be more calmer, more communicative, less sensitive. I don't know. We'll have to see. We'll see what this next 5 years looks like.
Yeah.
But
And as an adult, I guess, how do you balance now his autonomy with his safety?
mm-hmm.
I know he's living in the house with
Mm-hmm.
3 other people, or
Yep, 3 other people. I mean, in our homes, we have cameras in the common areas. We have a lot of eyes on our guys, and I think we've developed a culture of, you see something, you say something. A lot of times it's burnout. It's just fatigue, not recognizing that, or there's also lack of, like I said, that ego, where I know what I'm doing, and that's nice what you're telling me to do, but I'm going to still do it my way, and things don't necessarily work out that way. And then being here in the church, there's extra eyes on. So I mean, I'm not living in in denial. I know that abuse and neglect, unfortunately, are very prevalent. There's like a 70% incidence of that, and it starts with verbal abuse, and so we just have to be vigilant and keep educating, and not settling for somebody who maybe is just not the right fit. Sometimes you're just not the right fit. So.
Yeah. Has he ever communicated to you about anything recently, as far as a change that's happened, or anything significant?
No.
That he's
No, he has
expressed?
not.
No?
No, he's not really communicated something that's changed. He definitely, his behavior will change based on change. So when we see poor sleep or change in irritability, it's usually linked to a change, staff change in schedule. And so we really try to use as much as we can social stories on like a regular basis. It doesn't have to be a special event for a social story. It can be, we're going to Dave and Buster's. Dave and Buster's, we're going to leave Southampton at 12. Lance and so is coming with us. We're going to what staff is coming. They want to know when we get there, what's going to happen. Are we going to have our own room? Are we going to be with group? Are we going to eat food there? What are we going to eat? Are we going to have dessert there? Can I buy something? What happens if I kind of don't follow the rules of Dave and Buster's? We're going to leave. because we have to leave, because we do have to function as good citizens in society. We can't just do whatever we want, right? And so that's a typical story that we read the day before with Michael and review it a few times so he knows what the expectation is. And I'll tell you, that preparation, of course, everything goes smoothly. Everybody has a great time. Everybody is thrilled. They, know what to expect. And but if we didn't do that, the opposite, typically would happen.
Right.
So you know what they say, what's the definition of insanity? Just
Right.
keep
the
doing
same thing.
things without any preparation and expect it to, go well. It doesn't. And that's just not for Michael. That's for all the guys. I mean, they, right?
And what's interesting is that particular event at Dave and Buster's, we were reviewing and we didn't include dessert. And Michael,
Yeah.
I was reviewing with him and two of his housemates, and he raises his hand. He goes, "Kim, dessert." And I was like, "Oh, you're right. I didn't include that." And Michael, again, he initiates things that are meaningful and valuable to him, right? So I said, okay, you know what? Let's find out more about that. Let's find out if Mom's willing to let us get something, vegan, right? It was like vegan, dairy-free. But then the other gentlemen were like, yes, what about dessert? And again, these are not people who normally advocate for themselves. Without a question and an answer, right? A lot of times I see these guys sort of as the fast forward of the young kids I work with, especially when I worked for insurance, that most of the dynamics are question and answer. And so to get a response that's not solicited by a question is very difficult. So when Michael said that, I was like, nope, stop the press. Can we get dessert? Maybe the answer is no. I'm not saying yes, but let me validate the fact that you've initiated versus going, nah, that's not happening.
Right.
We had some cake yesterday.
Right.
And going, let's see what your mom says. Let's see what your mom says. Let's see what your mom says.
Mm-hmm.
And that brought about another initiation from two of the other gentlemen who go, I'm going to bring my wallet. I'd never brought up the wallet. The other one goes, I'm going to bring my wallet too. I was like, well, this sounds interesting.
Mm-hmm.
What are you going to buy? Let me ask their parents. Is that okay? Both parents said, of course, no problem. But again, listening to that, which came out of this just preparatory thing, helped us understand what might have been on their mind and might have manifested itself into something like, unpredictable at Dave and Buster's, maybe upsetness. And now we go, we've cleared those things off their mind and we've given them concrete answers, yes or no,
Yeah.
Yeah.
You have to be prepared.
Yeah.
Mhm.
You have to be prepared. I think that's the biggest lesson for parents, no matter where you're going, what you're doing. You have to be prepared. You have to prepare things, and that's the only way. And prepare your son and daughter, either with visuals, with verbal, with both, and that set everybody up for success. You can't have magical thinking. It's not going to just magically all be great without that preparation.
So if you could magically wave a wand,
Uh-huh.
right, what would you want society really to know about autistic people?
I mean, when I hear some things like they're cutting funding for, individuals with special needs because there's fraud and this and that, or, now individuals who are on Medicaid have to reauthorize that they need Medicaid every 6 months. And I'm like, really? Parents have so much administrative and burden and caregiver. You have to do another thing on top of it. If you have a diagnosis before the age of 3 and you're 30 years old, you're probably not going to, not need it. So those are the kind of things that we're going to educate. When I say we go to Washington, these are the people we have to educate, because I can't imagine a person can look you in the face and say, you know what? You're right. Let's put a carve out for this. Let's put a carve out for individuals with a disability, before the age of 5 or whatever the cutoff is. But it can't be. This is ludicrous.
And I guess to parents who just received a diagnosis or recently received one about autism, what do you have to say?
It's going to be okay. You want to love your child. You're going to embrace all the beautiful things about your child. You would not want a different child. Your child's going to have there's going to be some things that you're going to work on and get good get good help, and recruit your family and friends from the beginning, so that you can have the energy and the strength. That's what I would have done. I guess I would have done that differently in the beginning. Felt like I had to do everything myself. If your Uncle Marvin says, I want to help, you say, yes, what day? Saturday mornings, great. Uncle Marvin's going to come and shoot baskets for 1 hour on Saturday morning. Aunt Sue is going to come and she's going to read to you, so that the mom and the dad can actually take care of themselves, get relationships building, so that it becomes less awkward on those holidays where you just seeing the child once or twice a year and expect everything to be okay. Michael has great aunts and uncles who, I think it would be very hard for them to care for him, but he feels the love. And when we get together, they all feel like I can do this. Like, let's go, Michael, for an hour. Let's, something that they bond over. But you can start that when the child's younger, and I think that would really help parents keep their strength, right, and take care of themselves.
Yeah, because obviously as a caregiver, it's very stressful and intense.
Can be, yeah.
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 And you don't have any time for yourself.
That's right.
Yeah. So is there anything else that we didn't cover that you girls want to cover? Doctors want to cover?
I would say, going back to what Dr. Lisa was saying about the magical thinking, it can be equally as exhausting sometimes, this proactive sort of, mentality, but the burden of not doing that is magnified. I've had clients who are like, we're going on an airplane. What should we do? And I'm like, okay, so what's the problems? And we examine and we talk and we plan it out. And they go, it was so easy. I go, because you were prepared. You didn't just go, let's see what happens here. That is sort of, it's a burden and a blessing, to be that prepared. But at the same time, you get the fruits of that, right? Which is you get to spend time and enjoy your kid and not worry about, the fallout of that. So spend the time being proactive, spend the time being pensive about who you are and what reads right for you and your family. Don't do anything that feels that you're not ready for or you're not right for. You may be ready or right for that at some point, or you might not. But really listen to yourself. I always talk to parents a lot of times when I get off the call with them, and I go, I want you to have a conversation with your husband without me on the phone. And I want you to come together and speak openly and honestly, and then we'll take it from there. You have to be really forthright with yourself, and you have to be really patient. And you have to look for support wherever it's available. Don't say no.
I want to make 2 comments, but I don't want to forget. One is the siblings. I think it's really, really important that, again, if Uncle Marvin's coming over and you have another child, make the quality time with your other child, because the toll that it sometimes is for the sibling, if they feel like they have to be perfect, they have to do everything right, because they don't want to be an additional sort of, if they feel like a burden. And so I think that's important, to give your other children that individual attention. I know that was something that we really tried to, not good enough, but definitely tried. And then the second is, you were saying about, it was something else.
Proactive preparedness.
Oh, I want to say that start to look at AI tools like Claude and ChatGPT. It has been a great help to be able to just dictate into, I'll just dictate into Claude and say, help me prepare a social story for my 28-year-old autistic son. We're going to an engagement party. There's going to be about 50 people. There'll be music. This is the appetizers that they're going to serve. These are the dinner courses that they're going to serve. We're going to dance. You can ask to take a break and walk around outside. This is who will be coming with you. Blah, blah, blah. And then in 30 seconds,
Pretty much.
it prints out a beautiful going to grandma's engagement party. And, we have some tools that can also make it a lot easier than it used to be.
Yeah.
For sure.
Yeah. Yeah, because 30, 40 years ago.
Yeah, you're sitting there. I have the old
Yeah.
construction paper little
Right.
books, and I really don't want to do that.
Yeah. Yeah.
Cutting out pictures and blah blah blah. So yeah.
Well, I want to thank you both
Thank you.
for your wisdom, your personal story, your knowledge, your experience. Thanks for doing this. Thanks for taking the time. And I'm hoping that the people who are listening and viewing and who are in need of services, that this was helpful.
Thank you.
Thank
Welcome
you.
to go to our website if they want to follow up. lovemichael.org, info@lovemichael.org, LUVmichael.org, and answer, send questions, and come to the conference September 14th here in Southampton, and then September 15th is Surfers Healing, which is a beautiful day, free for children and young adults on the spectrum who want a beautiful day of surfing. It's another thing one of those events that we host, so check it out on the website.
Oh, great. Absolutely. All right.
Okay.
Thank you.
Thank
Goodbye
you.
for now.